The terms fracture and broken bone have the same meaning, a break or crack in a bone. Fractures can be closed, in which the skin is not broken anywhere near the fracture site, or open, in which the skin over the fracture has been damaged or broken.
It may be difficult to tell if a bone is broken. Use the mnemonic dots: deformity, open wound, tenderness, and swelling to assess the injured victim. When in doubt, treat the injury as a fracture. Deformity might not be obvious. Compare the injured part with the uninjured part of the other side. An open wound may indicate an underlying fracture. Most fractures will not have an accompanying wound. Tenderness and pain are commonly found at the injury site. A useful procedure for detecting a fracture is to gently feel along the bone. A victim's complaint about pain or tenderness serve as a reliable sign of a possible fracture. Swelling may be noted after a fracture.
Other signs and symptoms of a fracture include the inability to use the injured area normally. A grating sensation can be felt and sometimes even heard when the ends of the broken bone rub together. The victim may have heard or felt the bone snap when injured.
Remember RICE as the treatment for bone, joint, and muscle injuries of the extremities. R represents rest, which means do not use the injured part. I stands for applying an ice pack to the injured area as soon as possible for 20 minutes. This should be done every 2 to 3 hours. C refers to applying compression for 2 to 3 hours with an elastic bandage after removing the ice pack. Fill in hollow areas with padding before applying the elastic bandage. For an ankle injury, use a sock or cloth shaped like a U around the ankle knob and secure it with an elastic bandage. After 2 to 3 hours, take it off and apply an ice pack again for 20 minutes. E stands for elevation. During applications of ice and compressions, keep the part elevated. During the first 24 to 48 hours, alternate ice packs for 20 minutes, followed by compression for 2 to 3 hours. At night, don't interrupt sleep to apply ice packs, but you can leave a loose elastic bandage on.
To care for a possible fracture, expose and examine the injured area. Check circulation, sensation, and movement. Apply a splint to stabilize the fracture. Care for dislocations in the same manner as fractures. Do not try to put the displaced parts back into their normal position because nerve and blood vessel damage could result.
Strains occur when a muscle is stretched beyond its normal range of motion and tears. Use the RICE procedures to provide care.